Hi everyone, I'm Dr. Deepu from the NewYou Center for Plastic Surgery in Hyderabad, and today I'm going to talk about abdominoplasty or tummy tuck. So a lot of women, especially after pregnancies or even after massive weight loss, complain of sagging and pendulous appearance of their abdomen. Now, this is basically because during pregnancy, the uterus, which is growing within the tummy, is actually stretching the rectus muscle. So, both men and women have a central muscle which is attached in the midline. So, with the growing uterus, what happens is the muscles get separated and they never come back to the original place. So, that gives a weakness to the abdomen. So, characteristically what happens is, when the patient is standing up, the entire intestines, kind of pushes the tummy forwards, and that is what we call divarication of the recti. So a lot of women who have had multiple pregnancies or even one pregnancy can have divarication of the recti, and these are the ideal candidates to undergo a muscle tightening procedure which is called as abdominoplasty or a tummy tuck. So, what are the advantages that this procedure can give in women? So, a lot of women have, a bad appearance of the belly. So, what happens is they try to hide it with different clothing and, uh, techniques. So, for such people, ideally we offer them a tummy tuck. So, ideally, a tummy tuck is done once the lady has actually decided to or has actually completed her pregnancies. So these candidates, we offer them a tummy tuck procedure. So it is nothing but a comprehensive abdominal reshaping. So in this procedure, we remove the excess skin and the fat from the abdomen. Simultaneously, we repair and bring back the muscles to the midline. And it is ideal for removing the loose skin, especially when there are a lot of stretch marks. So all the stretch marks that are below the umbilicus generally can be removed because we're removing the skin in that area. So it is also a modality in which the stretch marks can be removed. The only disadvantage of a tummy tuck is there will be a scar which is below the bikini line. So that scar is inevitable because in this operation, unlike liposuction, we are targeting both the skin and the fat. So a scar in the lower abdomen is inevitable. But these scars generally don't look like what they look on day one after a few months. And we have a lot of scar modulating agents now. We can even do a fractional CO2 laser to get rid of this scar if it persists after 6 months. So the main advantage of a tummy tuck procedure is that it boosts the woman's confidence. So it helps regain a natural contour and confidence in one's body's appearance. So many a times, a tummy tuck is done as a procedure along with the so-called mommy makeover surgeries. So a tummy tuck is generally done under regional anesthesia, either spinal or epidural, so you will be awake. And it involves 2 nights in the hospital. The entire recovery is almost like a C-section, and within 3 weeks, 90% of the healing is over. I would say probably 1 week to 10 days off from office would be advised, and 3 weeks of restricted exercises. Once after the healing is over at 3 weeks, one is permitted to do minimal exercises. But however, a period of 2 months before rigorous exercises can be done is generally advised to the patients.